pivoting a little more just into, we've talked a lot about the frontline setting. I think, unfortunately, despite adjuvant working and metastatic, there's patients who still don't respond to that frontline therapy. And I think, one of the more exciting developments has been the development of belzutifan in the past year. So I think there's interesting quality of life data presented. Libby, I don't know, your quality of life is critical. So
yeah, I think it was encouraging to see, in some ways, when I think that the ultimate value of belzutifan has certainly not been realized as monotherapy, and we're going to learn more about that. And in some ways right now, I sort of conceive of it as a TKI break, not just a treatment holiday, but an active therapy that also is a TKI break. And I think that's some of the way that I describe it to patients. But yeah, I think it was, pretty consistent in looking at more global quality of life, that it looks more favorable with belzutifan relative to everolimus. Some of the sort of role functioning, physical functioning scores were a little bit more closely matched. And in some ways, I think, our colleague who presented that data had really valid points and concerns about the extent to which the metrics that we use and the tools that we use, while validated and in widespread use, and easy to compare, relatively easy to compare across trials, the extent to which that they capture all of the most important aspects of patients' global well-being, I think, is in question. And just a little plug for the work of one of our other colleagues, Dr. Bergeron, who has developed a sort of a pared down, more focused version of a combination of several important quality of life questionnaires. And I think that there's real potential to optimize that with time. But in general, I think it's encouraging to see that, an agent with a novel mechanism of action is going to be associated with a good and acceptable quality of life for our patients. And again, participants in LITESPARK-005 had experienced multiple lines of therapy. So these are folks who have, more closely, they mimic the patients to whom we would offer this therapy.
I think what was really great too is that, while historically the quality of life in these phase 3 trials have been exploratory endpoints, these were key secondary endpoints. There was really some more rigor that was applied around the statistical analysis for these endpoints and the implementation of the quality of life instruments throughout the study. So I do commend the study team for doing that. I think we do need to try to homogenize our RCC instruments across studies so we can better understand what they actually mean.
Yeah, I think, we're all getting more experience now that it's FDA approved. Some of us have been using it previously in VHL patients as well. But back to what Libby was saying, these patients, it's so well tolerated that it's almost like a TKI break. These patients don't have to usually discontinue the treatments for other parameters.
Yeah, just like fatigue, anemia, but a lot of the side effects that really haunt our patients, the diarrhea, the skin symptoms, the oral symptoms, the weight loss, are really not that evident with this agent. And it's very dose dependent. You stop the medication, things get better, and so it's a good thing.